Tonight,
a family physician really is involved with the entire care of the patient and the family.
an ABC 27 special presentation.
We've been with him now so long. There's so much history that we have the two beautiful girls because of him.
Family Matters, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. Family medicine means comprehensive health care for all ages. It's a practice that's been around for 50 years. In the United States, nearly 1 out of every 4 office visits are made to a family medicine doctor. Family medicine doctors are the only ones who are qualified to treat people of all ages, from newborns to seniors. What type of care will you receive when you see a family medicine doctor? How does it make a difference? And what is the best way to find a family medicine doctor? You will find out tonight. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Hi, Christina.
Hi, Deborah. Specialists from Penn State Health are sitting right here. They're ready to answer your questions tonight. The phone lines will be open until 8 o'clock. Call the number on the bottom of the screen, or you can email your question during the show to questions@abc27.com. Doctors Kenyatta Givens and Alexis Reedy Cooper will answer your emails throughout tonight's show. All calls and emails are confidential, and I'll be back throughout the show to share some of those questions with you.
Thanks, Christina. Family medicine means the entire family is taken care of, and that's exactly what a Palmyra family wanted. Here's the Pensinger family's journey.
Come on, Stel. One more.
Jen and Paul Pensinger enjoyed the last few days of summer with their girls. In a matter of days, school starts.
Olivia is going into kindergarten this year, so we're really excited about that. A little terrified, but really excited for her. And Stella is going to be in her second year of preschool in Lebanon.
Trying to get the girls ready and get prepped, and all the new list of things that we need to have for kindergarten this year is fun. So yeah, it's trying to enjoy a little bit of what's left this summer and also be prepared for the start of the school year.
Precious moments that soon become special memories.
It seems like yesterday that we were, just in Penn State Hershey having them, and now all of a sudden they're here and they're just little people grown up.
One thing has remained constant, their family doctor.
We just kind of moved here about 10 years ago, right after we got married, and thought, well, it's time to kind of establish ourselves, and started looking for a family doctor.
We had recommendations from a friend of ours, about the Palmyra practice, which is right here, a few blocks from our house. And we were very fortunate to be able to get in with some of the good doctors at the Palmyra practice.
Hello, how you doing?
This is where Jen and Paul met Dr. George Henning.
A family physician really is involved with the entire care of the patient and the family. It allows for us to have a long-term relationship. We take care of 90 or 95% of the medical problems that our families encounter, and it allows us to get to know our patients and to get to know them as people as well as patients.
I adore Dr. Henning. I mean, we've been with him now so long, and like I said, there's so much history that we have the two beautiful girls because of him.
I first met Jen when she was pregnant with her first child. We actually start out with the initial pregnancy care, take care of our patients through the pregnancy. We do the delivery, and then we take care of the babies as well.
We had some complications with Olivia, but he was, right there through it all and made sure that we were taken care of.
Olivia had a bit of a slow start, and I tried to make myself available to help them through all aspects of the problems, and she came around and is doing very well right now. Beautiful young lady.
A year later, Dr. Henning was there for Stella's birth.
For me, having a family doctor means it's somebody that I can call, that if there is a concern, I can just call him and say, help me with this. And so he's coordinating everything.
For our patients, they don't have to tell their story over and over again. They see the same physician, and we know all about them. We know their medical history. We already know their other medical problems.
Paul needs a family doctor. He has diabetes.
with me in particular, the family doctor is very crucial and important for coordinating and keeping track of everything that's going on, because I see numerous specialists. With that, having one doctor that can make sure they're checking all my results, looking at all my testing, seeing when it's time to get this done and when to have blood work done, it's been very, very good.
I would say that my patients are my friends, and I think that maybe that's the difference. I look at every patient as a friend. I like to get to know them, and I think when you have a little bit of a closer relationship, it means a lot to many people.
If we need something, we can get in touch with him, and if he can't see us, he'll make sure we get in. So it's gives you a feeling of security, having somebody that's on your team and working for you.
Some reassurance that everyone in the Pensinger family likes.
I really like him.
And why is that?
I just like him.
And that is so cute to hear a 5-year-old say they like their doctor. Joining us right now is Dr. Matt Gruffin, Professor and Chair of Family and Community Medicine. Thank you for being here. Obviously, the Pensingers really enjoy having a family medicine doctor. Tell us a little bit more about the role.
So like they said, it's one place that they can all go. They have a partner, not only the physician, but the rest of the office. As you saw, they have this relationship, and it's ongoing, and it's not dependent on their gender or their age or their disease or the problem they're having, and it's comprehensive. And it started with helping them get pregnant and getting through the pregnancy and on to the next phases of their family's life.
And what is the benefit of having a family medicine doctor?
So the kids don't have to go to one office, mom doesn't have to go somewhere else, and dad doesn't have to go off to another place. So it's one place. The doctor and that team knows that family and knows their history, and it's a relationship or a friendship at sometimes. So.
And you can really look after most of the ailments, correct?
Absolutely. 90 to 95% of everything the family needs can be taken care in a family physician's office.
Now, if you do need to see a specialist, we know that Penn State Health has numerous specialties. How do you work with them?
So it's a coordination, it's a partnership. In the older days it was phone, fax. Now we can really sort of do electronic, we call it e-consults. You see the patient, things aren't going well, you've got questions, you send the message off, and even the same day get the answer back. Can move forward with that. Oftentimes don't even need to see the subspecialist, or the subspecialist recommends change in medication, some more tests, and then arranges to see them. So by the time you get to the consultant, the labs have already done, the tests have already done, and it's very efficient when you're actually in the consultant's office.
And that's actually what Paul had mentioned, because since he has diabetes, then Dr. Henning knows everything. All the information comes back to him.
Absolutely.
So I'm sure people are watching and they may say, hey, I may want to have a family medicine doctor. How do you find the perfect family medicine doctor?
So look at your family. Where is your family in its stage? Are you a young family like them, or are you an older family where you're an empty nester, or you're this between generation where you're taking care of elderly parents or grandparents? Ask your friends, where do they go who have a similar. Check your insurance, because in this country, insurance matters where you can go. And then think about, what is your daily life like? Where do you travel? So if you're only around your home, a doctor near your home is good. But if you're always at work somewhere else, maybe a doctor there, or the kids are in a school somewhere else, maybe there is the best place.
Right, and for the Pensinger family, right down the street from them. So.
Yes, right down the street in Palmyra. They had a great opportunity. It was close by, and they obviously built a very strong relationship.
Dr. Ruffin, we will check back with you in just a little bit. But first, if you would like more information about family medicine, or if you are looking for a family medicine doctor, this is the number to call, 1-866-284-7615. Now let's check in with Christina Butler in the ABC 27 call center. Hi, Christina.
Hi again, Deborah. The phones are busy over here. A reminder that you can call 717-346-3333. Here to answer our viewer questions tonight, Dr. Madama Nasser, a family medicine physician. Hi. Thanks for being here. We want to get right to our first viewer question. This viewer would like to know, My husband and I are talking about starting a family. What's the best way to start that process? Should I include my family physician in that discussion?
So starting a family is a very important decision. So my recommendations would be both you and your husband should probably go see your family doctor, include him in this decision so your doctor can review your history, go over your medications, provide you with some appropriate counseling so that you can have a safe pregnancy and a healthy baby.
Okay, thank you for sharing that. We'll talk to you a little bit in just a little bit again. And if you have a question, again, here is that number to call for a specialist, 1-866-284-7615, or you can email your question to questions@abc27.com. Deborah, back to you.
Thanks, Christina. Later in the show, we'll take you behind the scenes of what it takes to be a family medicine doctor. You'll meet residents who are learning the ropes. Stay with us. We'll be right back.
You're watching Family Matters on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us right now, Dr. William Miller and his daughter, Dr. Megan Mendez-Miller. Thank you both for being with us.
Thank you, Deborah.
Thank you.
Why don't you tell us about this? You both practice family medicine and you both practice in the same office, the Nyes Road office. Tell me, Dr. Miller, how long have you been practicing?
Just about ready to start my 45th year in practice. The interesting thing is the tens of thousands of patients I've seen, 80% of them are still in my practice today. And they are still seeing generation after generation. I'll pass this on to my daughter when I retire.
Oh my goodness. And how about you, Dr. Mendez-Miller?
I've been out of training about 8 years. So we figure several thousands of patients already that I've cared for.
Wow. And Dr. Miller, so your father, your uncle, and your cousin all practiced. Tell me, why did you choose to follow in their footsteps?
I was never pressured. I was encouraged by my father once I made a decision to go to med school. But he was a obstetrician, surgeon, family practitioner. His brother was a family practitioner, and his son was also in family practice. But I think what encouraged me to go was working with the pathologist in the laboratory for a number of years and just getting a feel for medicine and deciding that's what I wanted to do. And the rest was history.
Yeah. And Dr. Mendez-Miller, did you feel any pressure to follow?
Yeah, I mean, the opposite. My family, my father were very supportive of whatever I wanted to do with my career and whatever I had my aim for. I think I always knew deep in my heart I felt called to go into medicine and family medicine, but I certainly kind of tried on several different types of study and careers before I came back around to medicine.
And why did you decide to stay here in the area?
You know, from a practical standpoint, I'm a working mother. My husband works full-time, I work full-time, so it made sense for us to raise our family here surrounded by our families so we could have that support. But being a third-generation Miller family physician serving the Harrisburg area, I wouldn't practice anywhere else. I feel very connected to continuing to serve this community.
And why did you both, or what do you both like most about family medicine, Dr. Miller?
Family medicine allows you to deal with families from the cradle to the grave, so that you get a chance to take care of babies as well as older adults and watch them as they grow up, and they become almost like family too as you stay in practice with them. And I'm looking forward to transferring some of these patients over to my daughter when I retire.
And Dr. Mendez-Miller, what about you?
I think from an interest standpoint, you know, family medicine has the full scope of all the different specialties encompassed in one. So when I was a medical student rotating every month, I would call my dad and I'd say, I'm going to be a urologist, I'm going to be an ophthalmologist, I'm going to be, you know, an internist. And I just enjoyed every rotation, and family medicine really does allow you to do the complete breadth with patients, and then relationships with our patients is really the continuity that we have, getting to know people well, getting to know their families very well. We're just very blessed in that way.
And you get to really see the whole picture.
Absolutely. Yeah.
And I'm sure, Dr. Miller, you're happy that she stayed in the area too.
I certainly am. She's done a great job, and patients are looking forward to being cared for by another Miller.
Mm-hmm.
Great. Thank you both for being here, Dr. Miller and Dr. Mendez-Miller. Thank you.
Thank you, Deborah.
And now we want to go back to the ABC 27 call center and check in with Christina.
Hi again, the phone lines are open for a little bit longer. You can get your call in by dialing 717-346-3333. Again, the phone lines are open until 8. If the phone lines are busy, you can email your question during the show to questions@abc27.com. Let's go right to our next viewer question. My family is currently seeing a family medicine doctor that's about 40 minutes from our home. We're looking to find someone closer. Should we have all of our records transferred?
Absolutely. Your records are very important, and it is important that your new doctor gets all your records transferred over so that they can review everything that has happened for you in the past and carry and take your care forward.
Okay, and you were telling me earlier that that's a simple process, just a phone call and signatures.
Absolutely.
Okay, here's our next viewer question for tonight. I'm thinking about going to college to be a doctor. I'm trying to determine what the best field is for me. What's the best way to know that family medicine is the perfect fit?
So, congratulations and good news. I think this is certainly a good field to take up going into medicine.
Sure.
I would say, first of all, read up about what family physicians do. I think that's important.
Okay.
But then my next best recommendations would be find yourself a family doctor that you can shadow and kind of see and follow them along so that you can see hands-on as to what they do. And I think that would be a best way for you to see if family medicine is a good choice for you.
Sure, nothing like that experience. Okay, thank you, Dr. Nosser, for answering all of our questions tonight. Thank you also to our specialists from Penn State Health who have been taking all of our phone calls tonight. Back to you, Deborah.
Thanks, Christina. So we've heard about the benefits of seeing a family medicine doctor, but what does it take to become one? We found out.
Well, welcome, guys. So it's the first day of your home away from home for the next 3 years.
Just like the first day of school, this is the first day of class for new family medicine residents.
We are training the next generation of family doctors. So preparing them to go out after they leave here and provide care in the communities to which they'll serve.
It's really exciting. I've been working up to this point for the last several years, and it's really nice to actually be here.
It's really exciting to get to interact with the other residents as well as my co-residents and meet them finally for the first time.
And giving the tour. So this is our team 2 nurses.
At Penn State Health Nye Road office, there are several new residents learning the ropes.
We have residents here that are starting on nights, that are starting on sports medicine, really getting used to the feeling of being called doctor and having to make those decisions.
I'm on nights. So my first 2 weeks I will be in the hospital from 6 p.m. till whenever they let me go home in the next morning. So there, and then I switch to being on the day shift. So I'm just going to be in the hospital for the next month or so.
So we have on-site lab services here.
Over the next 3 years, these residents will learn what it means to be a family medicine doctor. As the name implies, taking care of the entire family.
There's not many specialties where you can see such a breadth of patient population, where you can manage kids and you can manage adults, and then you're able to build those long-term relationships with patients, and that's really exciting for me.
I really enjoy the role of being a community's doctor and getting to know people, getting to know their families, watching how kids grow and families develop, and kind of being part of their story.
Some already know where they want to practice.
I'm originally from Philadelphia, so I come from an underserved community. So being here in Hershey and being able to practice and learn and develop into a doctor in the community setting, I feel like I'll be able to go back and really serve the community that I come from.
Hello, Miss Rosie. How are you?
Dr. James Kent will return to his hometown to practice, the place where it all began.
My dad's a family doc, and 2 of my sisters are family doctors. And I guess some people try to keep up with their older siblings, but when my youngest sister went to medical school, then I thought, well, maybe I can go to medical school too.
Dr. Kent starts his 3rd and final year of residency.
When I swallow my spit, my throat is itchy,
Yeah.
and my ears hurt sometimes.
Okay.
He has developed close relationships with his patients.
So we treat the entire spectrum of the human condition, from prenatal care to birth to parenthood to pediatrics, to delivering your baby, to end-of-life care, and all the way through. And it's important to me to see some pediatrics, to see some teenagers, to see some middle-aged people, to see some geriatric patients. That's the rewarding part.
Dr. Kent will finish his residency in June. Then he plans to practice family medicine in Franklin County, his hometown. And joining us again is Dr. Ruffin. Now, when you were welcoming the students, the residents that day, you had said it was 35 years ago. It's hard to believe.
Yes.
35 years ago that you started your residency. Why did you get into family medicine?
Well, unlike Dr. Mendez-Miller, who went to it because of the family exposure and the calling, I had no exposure to it. I went to medical school really focused on trying to prevent suffering from cancer and was focused on oncology and then surgery. But then I found family medicine, and it was really that comprehensiveness, the relationships, the continuity, and the diversity, and also the fundamental issue, preventing disease, finding them early, which is where I found that best fit. And that's why I went into family medicine.
Now, some may ask, because when you try and get in touch with your family medicine doctor, they're not always in. So what is the team approach like? Do they share everything with everyone in that office?
So it should be a team effort, and really the team effort is from the person who answers the phone, to the person who greets you at the front door, to the person who puts you in the room, the nurse, and the other doctors. And a lot of us are working with nurse practitioners and physician's assistants who also help provide that care. So that's the reason they work together, they talk together, they share the records together, so that you don't have to tell your story over and over and over again, and you have a relationship with that team of doctors.
Now, do you find that more residents are getting into family medicine, or is there a shortage?
There's a severe shortage of family physicians all across
Wow.
the country. Our discipline has an effort to try to promote so that 25% of students would wind up in family medicine every year, but right now it's right about anywhere from 8 to 10% of students. So we have a significant shortage.
And how much time do you need to spend in school if you would like to be a family medicine doctor?
You've obviously got to go to college, and then you've got to go to medical school, which is 4 years, and then you go into a residency, which is 3 years. So it's quite a long time. We've tried to create scholarships to promote so you can reduce the costs, and at Penn State we've created an advanced accelerated 3-year program.
And tell me, when you talk about Penn State Health, many different research projects are happening at Penn State Health. Talk to me, how does it work with family medicine?
So it's a little different because we're not doing labs and test tube, and as it's comprehensive, it may be as much as looking in the community. So why does central Pennsylvania have high rates of heart disease and diabetes, the whole issue of addictions and opioids use? Or how do we make the practice better? How do we communicate more effectively? How do we bring other team members into our care, like a nutritionist? How do we get better preventive services delivered? Or like my research, how do we get newer preventive services, like let's get rid of colonoscopy, which no one over 50 wants to have to do, but how about a simple blood test? So that's where like I work with basic science people to bring it to the patient and make it simpler and more deliverable.
And you mentioned colonoscopy. As far as like procedures like that, minor surgeries, is that something that a family medicine doctor handles?
Yes, we do a lot of simple procedures in the office, a lot of testing in the office, and a lot of other types of things you can get right there. So you don't have to go somewhere else to get it done.
Okay, that's good to hear. Now, family medicine has been around for 50 years. How did it start?
So think about 50 years ago. You may not have been old enough to remember it, but the 60s, it's Vietnam, it's social unrest, which was mainly race then, and the population was complaining that medicine is too expensive, it's hard to get into, and it's very fragmented. There were heart disease specialists, diabetes, endocrinologists, and they weren't working together and they weren't communicating. So it really grew up out of a grassroots movement to focus on the family in the setting in which they live.
And how do you think it will continue to evolve?
Well, what's going on right now? We have an ongoing war, we have social unrest that's not only race, but gender and gender identity and economics. It's access issues, the cost is. So we're still in need, and I think some of the struggle is there's just not enough of us, and we keep pushing to grow more and to build teams and partner together.
And when I was reading about family medicine, I had seen that it was originally called family practice. When did it change? Why did it change?
So it grew out of general practice, family practice, but that doesn't really make a lot of sense of what we do. We provide care and medicine to families, so family medicine was a much better fit, and it was just an evolution of the name.
And I guess what is the main benefit there with working at Penn State Health and having the opportunity, I guess, to work with specialists?
So at Penn State Health at the Hershey Medical Center, it's the opportunity to work with a specialist, to train and influence students, and have residents working right alongside them, as well as be in the community and provide care directly to the patients in the area.
Okay, a lot of really good information, Dr. Ruffin. Basically, the bottom line is Family Medicine Doctor provides coverage from ages from newborn all the way to seniors.
Well, even preconception. So how can you get pregnant safely and then deliver safely, and all those transitions through life and all the struggles that families go through. They're there to help make you survive and get through and be as vital as you can.
Okay, thanks again for joining
Sure.
us this evening. And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information about a family medicine practice, call Penn State Health at this number, 1-866-284-7615, or visit online at hmc.pennstatehealth.org. We want to thank you for watching tonight, and we wish you good health.